Hello, everyone. My name is Ginger Ruiz, and I'm the Workday AMS Director here at Avaap. We are so excited that you're joining us today. This slide is just a quick illustration of what distinguishes our post-production support or AMS support from a regular help desk. We are here with cross-functional consultants, including engagement managers within our AMS practice to help you with any of your Workday post-production needs. Avaap is a certified Workday partner for advisory services as well as AMS, and you can learn more about our company by visiting our website at avaap.com. With that, I'll welcome you once again, and now I'll turn it over to David and Cathy for introductions to get us started. So thank you again, David.
Great, thanks, Ginger. Appreciate the introduction. To introduce myself, I'm David Siss, a senior consultant at Avaap. In my experience, I've been in the ecosystem for over 3 years now. Prior to that, my focus has been on implementing digital transformations, specifically with benefit platforms. And I've also been on the client side, working with Workday, and worked as a benefits administrator in the field. So I'm looking forward to being able to provide some information to everyone today that may hopefully help them with completing the ACA requirements. Cathy?
Thank you. My name is Cathy Dosen, and I am a senior consultant with Avaap on the AMS side. So like David, I've been in the ecosphere for a few years now, and started out at Workday and then came over to the AMS side, was in on the client side as well. I really enjoy helping our clients who are post-production continue to implement things and dive deeper into those modules. So with that, we will jump into our agenda. There's a lot of detail surrounding ACA, as we all know. So David and I are really going to try and hit the high points. I'm going to be sharing the slides and talking to the pieces, and then David will be in the GMS tenant and kind of demoing and previewing what that will look like for you. We'll start with the introduction, and then we'll go into the features. And then we're going to go into the Affordable Care Act reporting configuration, ACA Dashboard Detail, the measurement period, eligibility, and then the forms. And then lastly, we'll give you some helpful resources that you can look into on community that will give you a little bit more information. All right, so we're going to jump into the Affordable Care Act features. Workday offers features to help customers comply with the Affordable Care Act, which we'll probably also refer to as ACA on this webinar. Using Workday's ACA features allows you to pull together all of that employee data and help you manage and remain compliant with those ACA requirements. The features can really be broken down into 3 categories. The ACA dashboard, which is some reports that will help you identify those employees that need to be included. The ACA measurement period, which is the piece of eligibility in the measurement period that will help you track the variable hours for those employees. And then that piece triggers the benefit enrollment event, whether that's the passive event or open enrollment. So, and it can automatically detect when that employee is making an eligibility change. And then lastly, the reporting, which is the 1094 and 1095C. All right. So these are the steps to configuring ACA in Workday. This is sort of a condensed version, but if you can think of these as your standard operating procedure when you're going and thinking about what to do first, we're going to start with the Affordable Care Act reporting configuration setup. And then you're going to do the ACA measurement period eligibility rule. And then you're going to do the actual measurement period configuration. And then from there, you're going to look at your benefit groups and the plan eligibility rule changes that you might need. Then you can create your benefit event type. So that could be a passive event, or it could be open enrollment. And then you're going to want to update your enrollment event rule to include that event, tell the system how it should work, when it should start, what it should offer. And then if you want, you can also create and schedule that passive event for ACA if you're not going to use open enrollment. Right, so the first piece that we're going to talk about is the reporting configuration. And this is what I like to refer to as the heart of ACA within Workday. This configuration feeds the dashboard reports. It feeds other areas like your measurement period, your company configuration. It all is housed within here. There's also information about the federal poverty levels and things like that that will impact the codes that come out on your reporting. So this page is really important. We're basically telling Workday how we want all these pieces of the puzzle to work together. So it allows you to confirm information for the dashboard and the measurement eligibility functionality. It allows you to identify the worker population, which we can see on the screen here, look back dates, whether you want to use the paycheck dates or period end dates. There's lots of information on this screen. This is not the whole screen, so David will actually show us what that looks like when we kick it over to him. And David, did you want to show the configuration reporting page?
Yeah, great. We can start with that one. Go ahead and take the screen if you don't mind.
Yeah.
Great. So just to level set, as we mentioned at the top, and Cathy had said, we're really just going to go through a high-level overview of the functionality and ensure that we document some of the core components of this. So just to confirm before we start, can everyone see my screen? You should see the Affordable Care Reporting configuration screen.
Yeah.
Fantastic. So some items to highlight on the screen, as Cathy mentioned, there are core components. One of the most important ones being the ACA eligibility rule. So this is an eligibility rule that you are configuring as you would any other eligibility rule, whether it's for a benefit plan or a benefit group, and you're just indicating that this is the ACA measurement period, right? So what you see right now on screen is just a very high-level definition for this eligibility rule. The employee is in an assigned organization, that they are active in the U.S. Again, this is a U.S.-specific compliance item, so this condition is always included in that measurement eligibility rule. And then here we're looking for hourly compensated employees. And then if their total hours are 30 hours or greater. So pretty straightforward standard measurement period. So then what Workday is going to do is going to evaluate the employee records and their data based on this eligibility rule. Another key item is the look back dates. We want to ensure that our look back dates align with our measurement period. And then you'll see, as Cathy mentioned, some of the standard components. Here we are pulling in or measuring against 30 hours per week, 130 a month. And you'll see that there's also some guided assistance too as you're going through this configuration. Some of the more enterprise specific components that are necessary that we won't delve too much into are the Workday payroll source. So if you are using Workday payroll as a unified solution, the hours that are calculated within the tenant are going to be applicable to ACA measurement. However, if you're not using Workday as a Workday payroll as a unified solution, you'll see you do have the ability to import data, and there's an entire process for that, which we won't get into today. And again, another core component, as we mentioned, you have the federal poverty levels and affordable care coverage standards, and these are updated year to year. The most recent one for 2021, federal poverty level is 12,880. And then the percent of annual income, 9.83. So in my experience, what it helps do is think of this as really pulling in all of the data that's going to be needed on any of those dashboard reports, right? So there's a couple examples of those that we'll get into. And you may not know that there is the Affordable Care Dashboard application. You can attach that to your home screen. And then what's going to happen is once you process that, you'll see that Workday is generating data for these specific reports based on what we've configured in the Affordable Care Reporting configuration. So here we have real-time data on part-time employees that are working more than the federal standard, part-time employees eligible for ACA, and ACA qualified employees enrollment count. So this is real-time data based on what we've configured in the Affordable Care Reporting configuration. Let's say perhaps we want to look at a different year, right? We want to look at 2019, 2020. We can change that rule. It's already in the tenants, and then we'd adjust our look back dates accordingly. But the key takeaways from here are that these core components are what's driving the information you're seeing on your ACA reports and on that dashboard. And with that, I'll turn it back over to you, Cathy.
Awesome. Okay. All right, so yeah, David went into a preview of what those dashboards look like. The dashboards are really the second kind of category of ACA, if you will. So here, like he illustrated, you can pull those things onto a dashboard. If not, they are freestanding Workday standard reports within the tenant. Dashboard is made up of the two reports that he showed, which are planning tools to kind of help you identify the areas of liability that you may have as a company, so that you can, you know, it'll help you to prepare to comply with ACA. These reports are based on the ACA configuration, which David illustrated. They're not the measurement period. So, and you can create custom versions of these reports. You don't have to work with what's delivered. You do have the option. They are written so that you can copy them and customize them if you want. That first dashboard or the first report, the ACA qualified employee count, it is very similar to your enrollment count report. It's going to show you employees who meet the following ACA criteria, who's enrolled in medical and who's not. And then the second report is called the part-time employees working more than the federal full-time standard, which is a very long report title. But this one is going to show you all those employees who are working more than those hours that David shows you, the 30, 130, the weekly, monthly hours that are put into the reporting configuration. And it's going to tell you, when you click into the details, it'll tell you how many hours they're actually working. And that's what is allowing them to meet that threshold and then become ACA qualified. All right. And so here, again, David illustrated this in GMS, but this is what the ACA qualified employee count report would look like. You can see that in this example, there's 48 total employees. 30 of them have enrolled in medical, 18 have not. So you can come in here and you can kind of figure out, wait, why are those 18 people not enrolled, and kind of manage it from this end. And then this is the part-time federal full-time standard report. And then if you clicked into those numbers there on the bottom, the 42, 4, that's going to give you even greater level of detail, where you're going to see the employee specific information, their name, the amount of hours they've worked, both weekly and monthly, to make them pull into being eligible for ACA. All right, and then David did show you the demo already, so I'm just going to go ahead and skip right into the ACA measurement eligibility. All right, so there's a one-to-one relationship between the measurement period and the measurement period eligibility rule, meaning you want them to talk to each other. You want them to match in terms of years, so that they're easy to reference and easy to understand. But because there is that one-to-one relationship, you are going to have to create those year over year. So as part of your open enrollment checklist, when you pull that down from Workday, there's a whole ACA section in there, and it will remind you to create these measurement periods so that you've got them going into the next year. And that's really the main thing that you want to remember, is that you can't reuse the measurement periods. And then also, again, recommended to kind of name them for the year so that you know which one you're pulling in, because that is referenced in a lot of different areas. It's referenced on the reporting configuration. And so you just want and then the passive event possibly So you just want them all to match and for ease of use. All right. So there's two different measurement periods. And then so basically after you establish the population that you want to measure, you need to establish the measurement period. There's two different periods within Workday. There's the ongoing measurement period, and then there's also the new hire measurement period. This is all on the same page, so it's easily referenced, but the initial or the new hire period typically starts on the hire date for the employee, and then it lasts for the amount of months that you've determined, so 3 through 12 months. Here you can see this is illustrated as 12 months. And then at the end of the measurement period, Workday averages those hours worked by the new employee during that measurement period. And then it compares that number to the hours per week on the ACA reporting configuration screen, which was that 130 to determine if the employee should be considered full-time for ACA. The ongoing measurement period evaluates the variable hours that the employee has already worked, or that the employee, the measurement period evaluates the variable hour employees who have already passed the initial ongoing or the initial new hire period. And this is typically set to the same as the new hire. So in this slide, you can see that the measurement period is both 12 months. The admin days are both 90. So it's very common for these to be, to mimic each other. And then at the end of the ongoing period, Workday does the same evaluation to see if that employee has worked the average of 30+ hours. And if they have, then they should be offered medical coverage. And this is an example of what a measurement eligibility rule would look like. So this rule defines the population of employees you want to measure for determining ACA. It's going to identify the variable hour part-time employees who are scheduled less than 30 hours, and those people should be measured. So once a measurement period eligibility rule is tied to the measurement period, cannot be reused, which is what we just went over in the last slide. So again, you're going to need new rules year over year to make sure that you're all the puzzle pieces are talking to each other. You can copy the condition rules. So you could use this exact same eligibility rule year over year. It's just that you have to create another one. And then this slide is going to illustrate the ACA flag eligibility. So this flag sits in several different areas, the benefit group being one, and this is going to flip. It's a Boolean, so it'll flip if the employee is actually meeting the requirements, and it will put them into the correct benefit group. So here you can see it returns true if the worker is qualified as full-time according to their most recent ACA measurement period. And so this just kind of illustrates that Workday is kind of doing this lift on your behalf by using this field in the benefit groups. All right. David, did you want to review that? Did you want to do a demo?
Yeah, if you think that, yeah, we can review that one. The eligibility flag functions.
Yeah.
Yeah. Get there. That's the portion with the benefit group, right?
Yeah. Mm-hmm. I can actually roll through the benefit eligibility if you want me to. Okay.
Okay, you should be able to, can you see that now?
Yeah.
Yep. So this is the flag that Cathy was talking about, and it's default flag within Workday. So if we bring it up and look at it, really what it's looking to do is see if that flag is set on the employee's record. If that flag is not set, and keep in mind, Workday's going through and completing this evaluation in the background. If it's not set on the employee's record, then they won't be pulled into that report that Cathy was mentioning, or any of the other dashboard reports that we've talked about. So this is something that may affect them when you get to Form 1095, 1094 reporting. But this is a Workday delivered field that will be set for the employee as part of the evaluation. So it's important to include this field on any of the ACA eligibility rules that you're creating for a benefit group. Any other thoughts on that, Cathy? Is that covered?
No, it's a big piece. I feel like
is.
for ACA, right, and Workday's doing a really heavy lift for you by having that configured. So I just kind of wanted to shout it out. All right. So can you guys see the, sorry, hold on. Screen. Okay. Let me go back a slide here. So there's several different ways to configure the benefit eligibility rules so that the ACA full-time population it does get offered those medical benefits or medical coverage. And all of them use that qualified as full-time based on ACA measurement period flag. These are the three options. Option one is to create a separate benefit group for your ACA full-time employees. This is the one that I personally see most common. You typically will have full-time, part-time, and then ACA. And then as David illustrated, that flag is on that benefit group eligibility. And when it's triggered, then your employee will go from part-time into that ACA group or vice versa. Option two is ACA full-time employees are in a part-time benefit group. So this is where you're just grouping them together. You're not calling them out separately. And you're going to add the medical plans for which ACA full-time employees would be eligible. And then you can apply a benefit plan eligibility rule so that that benefit plan only pulls in those ACA full-time employees. The note down there is just be cognizant of what you offer your employees and the benefit plan year end date. So if you're going to run it concurrent with open enrollment, this one might not be the best option. But if you are running a passive event in the background, you may decide to go with this one. And option three is you could include an ACA full-time employees in the full-time benefit group. So you want to make sure you're writing the eligibility rule to include those ACA full-time employees. You want to exclude the part-time benefit group. And then the ACA full-time employees would automatically be included in the open enrollment with that group. Part of the configuration to make sure that the medical plans are offered for ACA is to make sure on the maintain coverage tab, you're marking those medical plans as medical. There's a little box there, you want to check it. This tells Workday that that is something that is a medical plan and should be offered. And then on this screen, you can see here that these are the ACA options, and David will show you this in real time. But on the benefit plan report screen, you'll see these boxes across on the medical plans. You're going to want to go in there and specify what the plan funding is. Is it self-insured or is it fully insured? If that plan is your ACA minimum value coverage plan, if it's the minimum essential coverage plan, and then does that cover your spouse or dependents? And then also, if you'll remember on the ACA reporting configuration page, there was that dependent eligibility rule that references this, whether you can include your spouse or your dependents. All right. And I will throw it over to you, David, and you can share those pieces.
Great. Thanks, Cathy. Yep. So as Cathy was saying, one of the key parts of accurately reporting the information for ACA is ensuring that your medical plans are set up accordingly. Can everyone see my screen? You should see the benefit plan. Fantastic. So those fields that Cathy was talking about are grouped together in this portion of your benefit plan configuration. So here we're indicating if the values are, if the plan itself is self-funded or fully funded, if it meets the ACA criteria for the minimum value of coverage. There's been some discussion anymore about how do we really define that. And then from what we've seen, pretty much any plan that's been put in place since 2015 is going to meet this criteria, especially if you're offering it as a self-insured entity. And then also in addition to the Affordable Care Act options regarding the plan itself, there's the essential coverage components. So here we're indicating if this plan meets the criteria for minimal coverage for the employee, the spouse, and dependents, and if the spousal coverage is offered conditionally. So all of these settings within that plan are components that are going to be evaluated in the ACA reporting and in 1095, 1094 information. Okay. And then Cathy, I think we're good to go on to the next part.
All right, everybody's last part. We're moving right along into the forms. And these, of course, being your 1094 and 1095. So the 1094 and 1095, there's some configuration behind that in the tenant. You're going to want to configure your ALE and bring in any of your companies that you need to. And then you're going to want to go and configure your 1095C for your company. And then you're going to calculate. And these are all tasks that you can do. They're all forms that are in Workday that make it very easy for you to populate these forms. But you'll calculate the amount of full-time and the amount of total headcount you have per month. And then that is generated over on the company configuration page. Workday makes it very easy for you to recalculate at any point in time if you need to make corrections. They also allow you to override those numbers. If for some reason you don't feel like your data is accurate after you calculate it, you can go in and override it. The number, you can select 0 if you want, or you can change it to whatever number you might need to. Maybe it's not calculating the correct number. You've got a couple of people that you know were there and it's not pulling. So you can override that to whatever number you would need. And then the report feature allows you to offer to the employee whether they want a printed form or an electronic form. And then you can publish those forms into a PDF, and you have the option of publishing all of the forms or just for the subset of people who want a printed form. And you can check all that data, you can change it and republish. There's no amount. You can do that as much as you want, as frequently as you want throughout the year. And then when you're done, Workday does partner with CIC Plus. There's not a print integration connector available, but you can contact CIC Plus. They can, they can help you print and mail out those forms to your employees who have opted for a paper form. All right, and then David's going to very quickly show you what those forms look like in Workday.
Yes, fairly quickly and fairly high level. I think as most of us know that have worked with this, it's a very comprehensive process. And so what we're going to do is just review it at a very high level and walk through the general steps needed to complete the forms. So one of the things that's going to be needed is to create the ALE. Show that on my screen. Can everyone see my tenant? Cathy? Great, thanks, Cathy. So I've already created that, but what I want to do is just show everyone some general highlights of it. So when I view the ALE group that I created, right, you'll see here, I can view the ACA ALE group. We've done one for 2021. Okay, so I've created the group, and then you should be able to edit this too, just to give you a sense of how it's created. So here, if we had any additional companies, we could include those in here, right? So we're indicating the companies that are going to be included in this ALE group, and ALE being applicable large enterprise group. I always have a habit of thinking of it as an aggregated large enterprise, but it's applicable. So we're identifying the companies, and then we're indicating the months for which we're going to apply ACA data to this ALE. Okay? So pretty straightforward process on this end. After you've created the ALE group, then, as Cathy mentioned, one of the key components is looking at viewing full-time and total count details. So we've created that ALE. We can look at any of the companies within that ALE. And then the Workday will go through and generate the FTE count, the total, and details of those companies. And this may take a little bit of time as we go through. Even in GMS, there's quite a substantial number of records. But you'll see what it's reporting in this case. If we look at Logan McNeil, is this record included in the FTE count for this month, right? So this is where you're looking at that employee life cycle, right? Terminations, leaves, new hires, and kind of evaluating those life cycle changes against the data that's being generated here. Because again, this is what's going to feed into 1094 and 1095 reporting. Okay? That's always a good step. And then once you've looked at the details, the key is going to be, the next step is going to be to view the ACA company configuration. So we've gone through, we've made our group, we've done our details. Oh, there, just had it. Then we're going to view the company configuration. So you'll see we have this the history going through a number of years. We're going to look at 2021. Each year, this will need to be updated in case there are any changes. So on this company configuration, we're identifying the calendar year, the company, and then we're identifying information about the organization, right? Its address, whom should be contacted in case there are issues. So this is the information that's going over to the IRS and the 1094s, and who they should contact should there be an issue. A key part within this form is part 2, the certifications of eligibility. There is safe harbor, and there's the 98% offer method. Generally, what we've seen more often than not is the 98% offer method. This may be a question that comes up, so to give everyone a sense of it now, there's not really a defined process for how this is measured within Workday. We're getting some additional information on that, but that's been one of the common questions we've seen come across the AMS desk. The other portion that we have regarding the ALE is the member information. So if we're looking at creating the same minimum essential coverage for all 12 months, we can indicate yes. However, if there are variations from month to month, we can specify those. And then what we're seeing is a similar reporting or counting for what we saw with the FTE and total count report. Here we're able to look at each month and the number of full-time employees within this ALE for that period. Again, this is a very high-level overview of this particular component. There's a lot of complexity that goes into this, but we want to give everyone a sense of the general process and what you're seeing in this particular component. Okay? So after we've gone through and we reviewed the company and created a company, we can generate the form data. I've already gone through and generated this, otherwise it would be pretty time consuming. Okay, so for 2021, we're looking at the company information, which will be fed to the IRS on the 1094. This is a chance to see what we've entered on the previous screen. And then the total numbers aligned with that ALE. There's additionally the indication that the minimum coverage was offered all 12 months of the calendar year, and then a total count of FTEs within that, or sorry, total employee count for that ALE, and then there's the indication of the aggregates. Okay. So lot more detail to come on this, but at a high level, we wanted to demonstrate that. And then from that is the process of creating the employee form, the 1095. So we won't go into the process of creating it. It's a little bit time consuming, but we can show you the general outputs from the creation of that data. So here we're evaluating the 1095-C form is the information for each specific employee and their covered dependents. So if we look at Jack Taylor, for example, we'll see that he has coverage under all 12 months. And again, the values that are on here are determined by the IRS, the necessary reporting codes. So we'll refer you to some reference materials for evaluating these items as they are reported if you're doing any auditing or validation. But this would be the general process of completing the 1094-C forms, 1095-C form data. And then subsequent to this, when we've gone through and validated it, you can publish these and it will push the 1094 data to the IRS. And then the 1095-C forms will be available electronically or as an export that you could send to a vendor. At present, CIC Plus is the only vendor that has the authorized integration, can connect directly with Workday and complete that process for printing. Otherwise, it's a manual process of exporting, creating a PDF, and submitting to a vendor. So again, very high level overview. Completely understand there might be enterprise specific questions about that. So I certainly recommend reaching out to your AMS counterparts, very qualified in explaining that, but it would take substantially more time to explain that than what we have in the webinar. And we want to ensure that we're able to get as many and as much information out to everyone as we could. I would stop sharing. Cathy, any other questions that we have in the deck?
Yep. So just lastly here, thank you for running through all that. These are just some helpful resources. These are some links that you can get when the marketing team pushes out the deck. These are all going to point you to some really great information. Community has a ton of information about how it's configured, what it means, how it works. And so we would be doing you a disservice if we tried to replicate that, because Workday has just done such a wonderful job at putting all that out there for you. It's readily available. And also it's updated with any type of release information that may impact it. So I recommend just always going to community so you can get the correct information. There's a checklist. That checklist is also in the open enrollment checklist. So I always urge all of my clients to make sure that they're taking a look at that checklist every year. It's going to remind you to do all the things you need to do, such as create those eligibility rules, create the ALE, things you have to do year over year for ACA. The reporting feature FAQ is fantastic because, like David said, there's just so much complexity that goes into those forms. What the codes mean, if you change your poverty level, that could impact it from a 1E to a 1A, that type of thing. Beyond that, the Benefit Next Level series is just fantastic. It will kind of run through the basics for you. So benefit eligibility, plans, eligibility rules, all of those things that ACA leverages but are not just for ACA. And then below, there's also some retired content. So when you click on these links, it will give you the retired content banner at the top. But I still reference these because they've got really great information on the integration and the support that you can get, and also just kind of explaining the base and familiarizing yourself with the terminology and things like that. So the more you see it, the more it's going to become familiar, the more you're going to understand it. So I still highly recommend checking out the retired content. And then we can open it up to questions. And Abby, do you want to
Yeah, I can absolutely kick off some questions. Thank you, Cathy and David, for presenting on ACA and Workday. I definitely learned a lot and appreciated the well-organized content. And I want to thank everyone for joining us today. If you do have any questions, please feel free to use the Q&A box and we will address those. If you want to talk about ACA, Workday, or post-production support for Workday and how it can deliver a competitive advantage for your organization, send us an email to info@avaap.com and let's get a conversation started. I see we have some questions that came in via chat and the Q&A. So are you ready, Cathy and David?
Sure.
Yeah, let's shoot.
Awesome. The first question that came in was, when is the ACA eligible employee report run that is based on the Affordable Care reporting configuration? On the last day of the look back period, 12/21 in your example?
So is the question, at what point should it be run to collate the data to load for the forms?
It's looking at that entire period.
Yeah.
Yeah, so on the ACA reporting configuration page, when it's got that, 10/2021, 10/2022, it's evaluating that entire period.
Mm-hmm. And to tag on to that, what it's doing is it's looking at that period at the point of runtime. So if you're running this today for 2022, you'd get data through today. So it's measuring within that period, the look back period that you set based on the eligibility rule and where do those employees stand as of runtime. So you can run this on a regular basis to see how you're tracking, or you can run it at the end of the year to evaluate that against what you might have for your 1095, 1094 forms.
Yeah, I have several clients who run it frequently so that they know like where their part-time people, maybe interns too during the summer, are working a little bit more than they should. So they're kind of monitoring that data throughout the year.
Thank you. So next question is, in your example, you had it set up as 30 or 130-hour conditions. Is it always those conditions, or can it be set up for one or the other?
It's looking at both of those conditions. You can change those numbers if you need to, but it's always looking at those two conditions, whether you're meeting 30+ hours or 130.
Next question. We have one company, but healthcare benefit plans that end at different times of the month if terminating. The 1094C company configuration task has a box that says use coverage end date and month of termination. This impacts the coding. How do you create proper coding if not all of our healthcare plans end at the same end at the end of the month that the person is terminated?
So that will be controlled on the loss of coverage tab. Is that where you were going, David?
No, I would go ahead.
Yeah. So if you're, I think if I'm understanding this correctly, you may have some plans that end on event date or at the end of the month, or they may have a grace period. I don't know if I'm understanding that correctly, but that's all handled on the loss of coverage tab. So if you, for example, are ending it on the event date, you would want to use that checkbox so that it shows the code for that month. And then like if they had minimum essential coverage for 6 months, it would be 1A. Maybe they fall out, and then it's going to be a different code for the rest of the 6 months, if I'm understanding it correctly.
Yeah, I think that's something worth looking into. If I'm understanding it correctly, it sounds as though there's the offset so that coverage always ends the last day of the month. And then, so you have that as the transactional output. And then it's the question, what should be checked on the forms to look at that eligibility coverage? I think that's something worth looking into a little bit further that we may not be able to get into today, but definitely worth looking into.
Yeah, so you're on the right track. Like the the controlling pieces are on the enrollment event rule, and then on the configuration page to say when you want it to end.
Thank you. Next question. Is there a way to add a 1095C for an employee who is still on our insurance but no longer in Workday?
There is, and if I'm understanding correctly, it's probably a COBRA record, somebody who's not an employee but is a COBRA participant. There is a way to do that, and it's on actually the ACA reporting features FAQs. I can put that link in the chat if that's helpful. But I think that's one that we included in the deck, Cathy, right?
Yep.
So, Abby, I'll just put this in the chat to everyone. That one there. But yes, you can load COBRA participants into or onto the forms, even though they're not an employee within the tenant.
Awesome. Thank you. Next question. Our ACA ALE groups are only used if each different company has a different FEIN?
It's a couple of different things. So it's like if the company is over 50 employees and different FEIN. And that's very likely already set up on your HCM side. So you would just want to identify which ones you need to pull in based on like the 50 employee threshold or whatever the IRS pushes out as a threshold.
Thank you. Next question. How does Workday handle status changes from full-time to part-time for ACA measurement and eligibility?
Ask a clarifying question. Is it when they're turning, so it's on an eligibility change. I like to think of it as a job change, if I'm understanding this correctly. So it's very similar to a job change, right? If I'm moving from part-time to full-time, Workday is taking that benefit event and it's set to on eligibility change only on the enrollment event rule. And so it's measuring whether or not there's actually an eligibility change. So are benefits impacted? If yes, then send out the benefit event. But hopefully I understood that correctly.
Thanks. David, I know you answered a couple of questions in the chat. I am going to go ahead and ask them again just in case somebody missed them. So one of the questions was, so you should configure a new measurement period and measurement eligibility rule for each year. These should not be used for multiple reporting years.
Correct. Yeah, those should be configured every year for the measurement period and the eligibility, but you won't need to make a change to benefit group logic. So if you have an ACA benefit group, that can remain static, but the components that are related to reporting, leading practices to update that every year. And that's, yeah, every calendar year.
Awesome. Thank you. The next question that came in was, can you send the 1094-5 forms to employees electronically through their Workday accounts?
Yep, so it's just, it's very similar to the W-2 where they have the option to select whether or not they want that electronically. And then the task is my ACA forms, and they would be able to access those at any time.
Awesome, thank you. I think that covers all of the questions. If there are any remaining questions, please feel free to send us an email with those questions to info@avaap.com, and we can definitely help you out. Thank you again for joining us on today's webinar. There is a brief survey after logging out, and we would really appreciate you taking a minute to respond and letting us know what other topics you'd like to hear more about in the future. Thank you again, and we'll see you soon.
Thank you.
Great.
Bye.
Thanks, everyone.